Hey, what's up? This is Matt from GoTherax. Today I want to go over the assisted hip airplane. So the hip airplane is an exercise that we give to people that need to mobilize their hip joint, especially that are having tightness in internal and external rotation. This is a mobilization of the hip joint. This is going to help you gain control and stability in your hip joint. And what we are trying to do is to make sure this is done slowly and in control and to the limits of your movement. So it's going to look like this. If I'm doing this left hip, I'm going to put my hands onto the bar or any other upright object. Again, somewhere between shoulder to hip height, depending on your preference. Going to have it there. We're going to step with this leg more or less straight. I can unlock it a little bit, but I don't want to really be bent down. I just want to be on that leg fairly straight. The other leg I'm going to keep straight and I'm going to push it out behind me. This is the biggest mistake that people make, is they kind of leave this leg down. Instead, you want to push it out behind you, which means you have to keep that core engaged. So step one, I've got it out like this, and we're going to open this direction. So I'm pulling open this direction, feeling that tension in my groin. That's where my hip joint is. So I'm going to open up that hip joint this way, and then this is the hardest part, is now we're going to do the other one where I close this hip. So I want to rotate on this hip, dropping the hip down, but keeping the foot up until I feel tension on the opposite, on the outside of the hip. So again, if we look at it from this side so you can see the hip, I've gone open on this direction until I feel it in the groin, and then I'm going to close that hip, keeping the foot up till I feel tension here on the outside. And for me, I can feel tension that radiates down as well in this position, and then back up. So that is the assisted hip airplane. Generally, we're doing 5 to maybe 15 maximum per side of this, slowly rotating between internal rotation as far as we can, external rotation as far as we can, really trying to mobilize that hip and gain control over it. Thanks.